My name is Julia Goodman. I'm an assistant professor in the School of Public Health at Portland State University. So my research focuses on work and how people's workplaces, the kind of work that they do, and the benefits that they have available in their workplace affect their health and well-being, and particularly for those workers who also have caregiving responsibilities. Unfortunately, in the US, we are one of the only countries in the world, and the only high-income country in the world, that doesn't provide any kind of paid leave for any of those purposes. So as a result, we put workers in a really impossible situation where people have to decide between their livelihood, their job, and caring for themselves or for a new family member. One of the research projects I'm working on is trying to understand the impact of the country's first fully paid leave policy, which is a new paid parental leave policy that was passed in San Francisco a few years ago. We are trying to understand how this fully paid leave policy impacts people's leave taking and how much access they say they have to paid leave. One of the most striking findings from our study is the difference between lower and higher income workers in their understanding of the policies and the benefits that are available to them. Lower income workers in our study were much less likely than higher income workers to have heard of the paid parental leave policy that was recently passed, to feel comfortable with their own benefits available to them, and to report that they learned about the benefits or received any kind of information about the benefits from their employers. This was so striking because we expect that when we pass a policy like this, it can act as some kind of equalizer, but it's not actually beneficial to any of the workers if they don't even know about it, if they can't take advantage of these policies. Oregon recently passed the most progressive and inclusive paid family medical leave policy in the country, and it's set to be implemented in a couple of years. So along with my colleagues in the School of Public Health, Dawn Richardson and David Hurtado, we're starting to develop a new study that's really focused on making sure that everybody in this state has the information that they need to take advantage of these benefits. Making people choose between their jobs and being there during these critical life events is not the kind of society that we want to be. I think that we can create policies that support working families so that they can stay in the workforce if they want to, they can continue to be productive members of society, and they can also be there for their families when they need to be. What we really need to do is figure out how we can design and implement policies that support all working families to really achieve the health equity goals that we have. My name is Julia Goodman, and my research is focused on designing and implementing better policies to support working families.